Virginia has made significant progress in the fight against COVID-19, but health experts fear developing variants could set us back. We're bringing you in-depth coverage of the coronavirus.
Our Cameron Thompson tells us about efforts to help COVID-19 long haulers to recover. But first, Shannon Lilly is live with an update on Virginia's vaccine advancements and how new strands of the virus are still posing a threat.
Well, Cheryl, the race between the vaccine and the variants continues. Virginia health officials say June has seen a continuous decline in vaccination rates, and it comes at a time when infectious mutations are spreading.
I think it's just yet another reminder to us that we're not out of the woods yet.
A more transmissible variant that devastated India and swept across the United Kingdom has made its way to the U.S., making up 6% of cases now, a few already identified in Virginia.
But it's here in Virginia, and we're going to see more and more as the weeks go on.
Virginia's vaccination coordinator, Dr. Danny Avula, says the Delta variant could soon become one of the more predominant strains in the U.S.
We know that there are parts of our state where we are under 50% vaccinated. And so that reality means that we likely will see spread.
Dr. Avula says not only could new variants take hold in unvaccinated populations, but also may eventually impact the effectiveness of the vaccine.
Each new mutation of that S protein, each new mutation that leads to a new variant means that the vaccine is slightly less effective.
The good news, Dr. Avula says, is that current vaccines in the U.S. are showing to be about 85% effective against the Delta variant. But he says this highlights the need for more people to get the shot.
We're averaging somewhere between 6,000 and 8,000 new adults a day getting vaccinated.
And with that vaccination rate, Avula says Virginia is in good shape to meet President Biden's goal to have 70% of adults vaccinated with at least one dose by July 4th. As of Monday, the state is at 69%.
Right now, that equates to about 70,000 adult Virginians that we would need to vaccinate between now and July 4th.
But some people are still hesitant.
We've really shifted our model to do more outreach and education.
In Richmond, only 52% of adults have been vaccinated with at least one dose. Compare that with the 67.5% in Henrico. Kat Long, spokesperson for the Richmond-Henrico Health District, says they're addressing hesitancy by targeting communities with lower uptake and higher risk and bringing vaccines to them.
In some pockets of the north side, the east end, and the south side particularly are all really important to us. We're looking at areas in Henrico where there are lower income communities, in Richmond and Henrico where there are immigrant populations. We just want to make it as easy as possible and create as many points of access.
And Dr. Avula anticipates that we will reach that 70% goal in 7 to 10 days. Coming up at 6, find out just how much more contagious that Delta variant is and how you can participate in the effort to protect more Virginians. Working for you in Richmond, I'm Shannon Lilly, CBS 6 News.